to share the findings from the Women Rise project. This project was implemented in Banankwanta, Chingakrum, and Bamboy in the Savannah region and Bono East. And really the focus was looking at adolescent girls in galamse, or small-scale mining communities, learning more about their situation and co-creating interventions with them. You know, a lot of our research, we bring research or we bring projects to communities rather than asking communities what they want, what they would find helpful in their circumstances. And so this project was really exciting because we did discover a lot of interesting things. For example, only 18% of the girls we interviewed were actually in school, those aged 10 to 24. And so it means that traditional sexual reproductive health interventions that are delivered on school platforms are not reaching our girls in these communities. So we need to find innovative ways to ensure that we're meeting their needs and programming within the community. So this is an exciting time to take those findings, and then we worked with the communities to develop interventions, some economic ones, and then some mobile health clinic that was providing sexual and reproductive health services in the communities, very close to these young girls who find it difficult to access health services otherwise. So it's we continue to hope to learn from this and see how it can be applied in other settings, and existing programs through the Ghana Health Service and community agencies can continue to meet the needs of this unique last mile population of adolescent girls in galamse and artisanal small scale mining communities. We had 30 girls that did specifically the economic portions, economic interventions that they selected, that they would want to do. So 30 girls, and then we've had almost 300 girls attend the mobile clinics, and those are ongoing. One of the issues girls presented to us was they have a lot of mistrust in the health system. They fear that they will not have confidential treatment. They fear that they will be judged for coming for sexual and reproductive health treatment and counseling. And so we were able to train health workers in Bamboy and Banankwanta to go to the communities to provide mobile clinics, including sexual transmitted infection testing, treatment, and adolescent-friendly counseling. So the program was in such high demand that even beyond the girls in the mining communities, girls from secondary school, other women in the communities were asking if they could come to the mobile clinics, which brought services much closer to them, which we see as a priority if we continue to try and reach Sustainable Development Goal 3 to ensure health for all. We need to make our recommendation is that we ensure that we don't carry out research or implement projects that don't have the community's inputs, that projects and research studies really encourage co-creation with communities. We encourage the fact that even though we have challenges with galamse, all right, we need to ensure that those in mining communities, those stakeholders are brought on board early so they can be champions for good sexual and reproductive health and economic and interventions for young women. So we encourage researchers and project implementers to really co-create interventions and research for communities, and to look at what these sort of cost-effective ways of addressing some. Absolutely, I think building trust in the health system. We already have a Ghana Health Service that is existing. We have CHIPS compounds, we have health centers. So it's a very low-cost intervention to train health workers to ensure that they're providing adolescent-friendly care to address some of the sexual and reproductive health issues we're seeing in these communities. We heard today from the Regional Director for Youth Employment Agency. These young people can be prioritized in existing government schemes so that they have alternative sources of income to the galamse that they're doing, many of whom do not want to be in those unsafe contexts, but they're lucrative. So we can't just say don't be involved in galamse, don't do these things. What else can they do, and what else can existing government platforms provide and connect these communities
to those? I'm sure you saw the resource person who have undertaken research on the health and economic impact of small-scale mining during the COVID and post-COVID time as well. I think the fact that the target was women was very, very important. And the women between the ages of, I think, 16 and 24, which is very specific. And they are very active in small-scale mining in the Bandankwanta area, the Bole Bamboy Savannah region. That place has been endowed with gold. God is so kind that is giving that place and many part of Ghana gold, except that generally we have not been able to exploit it properly to our benefit without destroying the environment. That has to change. And again, the young people who are involved, you would see that they are within the very prime ages. And gold, they say, is a rubber economy or an exhaustible resource. When you mine, it doesn't grow again. So if you are at the age of 16 and you are engaged in the fringes of mining, that is carrying the burden, the ore, digging, selling sachet water and all that, when the gold is gone, your future will not have to question you. What did you do with the past? So what the university lecturers with support from Canada International Research and Development Center is to try and empower these women so that they will not remain in an unsustainable practice. And of course, most of them are working in illegal sites. So they will be there and then there will be some raid and they will have to run away. There was also a report of a mining site caving in. So it was needless for them to be there. Now the difference between what these people have done, these researchers have done, and what happens generally is what I've called this concept of alternative livelihood. I have said that alternative livelihood in the literature of mining, small-scale mining research, is very romantic. You know, everybody talks about, one of the ways of solving small-scale mining is to provide alternative livelihood. In most cases, our alternative livelihood programs are decided. We sit at policy areas and they say, okay, we are going to do oil palm plantation to bring people from mining. How many people want to be in the oil palm plantation? How many people don't want to compare the benefit of what they get in galamse and what they will get when they have to do, these? And we spend so much money. In fact, in the last administration, a lot of resources have gone to what has been described as alternative livelihood project. You would ask yourself, how many galamse people have been taken away from the operations into this alternative livelihood? My best bet is that most of the oil palm plantations or oil palm seedlings will go back to people who are not even interested. So because we didn't do any science of it, we didn't segment it, we just did that and the benefit is not realizable. What these researchers have done was to identify and then also ask the beneficiaries what alternative they were interested in. They gave their own alternative and then they supported them to start. Some of them are dressmakers, some of them are hairdressers and all that. And they have gone through the training. They have the capital. They were provided with the capital, and so you could see the report. They're very, very excited about what they're doing, and I believe they will leave. They would actually be the proper beneficiary of an alternative, which has been provided them because they were asked. They made their own choices, and they are also supported with capital. They've been capitalized to be able to start their work. And then the next thing that has to happen is to monitor, provide the support to monitor to the extent that they are sustainable, they can now run on their own. That is the way alternative livelihood works. It is not when you decide as a government or as a policy maker that we are going to provide seedlings for alternative, or we are going to make farm. No, for the boys who get 2,000, 3,000 cedis a week on small scale mining, they will not be attracted to this type of alternative livelihood. So I think I want to commend the researchers for identifying the main problems and proposing the appropriate solution to it.
The project is a good project. It has really helped most of the galamse sites in Savannah region. Most of the girls used to go to the galamse site before they get money to buy food for themselves and maybe their family. So this project has helped almost half of the community. Now some of them are learning how to sew, hairdressing, and they even gave some of them money to start up a business. So the project is a good project. It has helped.
So as a peer mentor, what have you achieved on this project?
They taught us how to save money. Sexual health, reproductive, they taught us. So I learned how to save. They even opened an account for us to save money. It has helped me as a peer mentor. They gave me money to start up a business. I did the business. I had more profit, and I'm using the profit to learn how to sew. And the business is still ongoing.
Advice to your fellow youth within the community?
My advice is that they should try their possible best to save money. No matter the situation, they should save money so that they will get money to learn anything they want to learn or to do any business they want to do. Because the galamse site is not good for girls or even, but it's not good for anybody. So the mercury they use is harmful. The mercury they use is very harmful. Even in the water bodies, sometimes you fetch the water to cook, you'll be falling sick. You know, if you go to hospital, they give you medicine still because of the mercury in the water. And the dust, it causes us to cough. The dust is not good. The galamse site is not good for the health.
Peer mentor, I'm free banakwanta. Your friend me hawa. Ba enam project 21st no na yes site me ton nsu me yi nsu wo bi fridge mu na maton.
Okay, site.
Ewo galamse site ba enne enam project 20 matima to fridge a me ankasa me yede me ton me nsu bande enam project 20 me suya hairdressing na adwuma enti meda omo asese omo aboa me enti me bom paye se nyame mboa omo so na omo ntimi enye den emboa afoforo a omo hia sa mboa ne bi na omo so mbeka ho enti me da omo ase achede so omo de ama me hairdryer and then boy din ba omo atimi ache me ba komeda omo ase nyame nhire omo nyame nka omo ho na next time omo nye embro sei